Have you ever dreamt of becoming a doctor in Australia? Maybe you heard about the work-life balance, the salaries, or the respect the healthcare system commands. But if you're an international medical graduate, how do you actually make that dream a reality? In this video, we're giving you a full step-by-step breakdown of the AMC pathway, the official route to become a licensed doctor in Australia. So let's get started. Australia isn't just a beautiful country, it's one of the top choices for doctors all around the world. Why? Because it offers strong healthcare system, high quality training, excellent pay, and most importantly, a balanced lifestyle. And right now, Australia is actively seeking skilled healthcare professionals, so if you're an international medical graduate, this might be the best time to start your journey. Before we jump into the process, let's quickly talk about eligibility. To apply for the AMC exam, you must be an international medical graduate and your medical college must be listed in the World Directory of Medical Schools. If your college is listed, congratulations, you're eligible to start the AMC pathway. Step 1 is all about verifying your medical degree. You'll start by creating an Epic account, that's electronic portfolio of international credentials. Here you'll upload your primary medical qualification for verification. Then link this Epic account to AMC portal. Once you've done that, the AMC will verify your credentials and give you access to the exams. This whole process takes about 2 to 6 weeks to plan accordingly. Next comes the AMC MCQ exam, the first big hurdle. It's a 3.5-hour computer-based test with 150 multiple choice questions. The passing score is 250 out of 500. You can take this test in various countries including India, which is super convenient. The exam fee is around 2,720 Australian dollars and there is a small authorization fee of 55 Australian dollars. Preparation is key here. We'll talk about study resources in a bit. Once you clear the AMC MCQ exam, the next stage is the clinical exam. This is a performance-based test known as the Objective Structured Clinical Examination or simply the OSCE. It includes a total of 20 stations, 16 are assess stations and the remaining 4 are rest stations. Each station runs for 10 minutes. You get 2 minutes to read the scenario followed by 8 minutes to perform. To pass, you must successfully complete at least 9 out of 14 assess stations. This update came into effect from March 2024. These stations reflect real-life medical situations set in both community clinics and hospital environments. But here's something important. This exam is only conducted in Australia and the fee for this exam is 3,530 Australian dollars. Now here's an alternative to the clinical exam, the workplace-based assessment or WBA. It's a 6-month-long assessment where you're supervised and evaluated in an approved Australian hospital. WBA is less exam stress but it's more expensive, costing between 10,000 Australian dollars to 15,000 Australian dollars and the seats are limited. Still, it's a good option if you prefer real-world training over exam environments. So how should you prepare for these exams? For the MCQ exam, resources like AMC Handbook, AMC QBank, GMU QBank and John Matta books are considered gold standard. Preparation usually takes up to 4 to 8 months depending on your schedule. Join Telegram groups, consider live or recorded classes and don't hesitate to form peer study groups. They help more than you think. Once you clear both exams or complete the WBA, it's time to register. You'll start with limited registration under supervised practice. Basically, you'll work under supervision in hospital. After 12 months of successful practice, you can apply for general registration. And here's the exciting part. Your earning potential rises significantly. Interns make around 70,000 to 85,000 Australian dollars and general practitioners can earn between 150,000 to 300,000 Australian dollars per year. In the next video, we'll break down the complete cost and timeline for becoming a doctor in Australia through the AMC pathway, from exam fees to travel, training and everything in between. So stay tuned because this is where the real planning begins.